I'm Dave Munday. I'm Lead Professional Officer with Unite Uni in the health sector, and I lead on mental health in the health sector. I've got a number of other colleagues that lead on lots of other issues. In terms of health visiting and school nursing, one of my colleagues, Obi Amadi, actually leads on that issue. So she's got more up-to-date info and experience and does a lot more of the negotiation and discussion on that topic now. I used to lead on health visiting in England a few years ago up to the end of the implementation plan, but since then have moved into doing more stuff around mental health. And as I'm sure you'll appreciate, that's a hugely busy topic in terms of the work that we do. Just to give you some background about Unite the Union, it is the country's biggest trade union. We've got 1.4 million members, and those people work across a huge range of industries. We've got people that are members that don't have jobs, so we've got community members, people that work in the travel industry, for example. We've got lots of members in companies like BA and Virgin. We've got members across the public sector, and a very large membership in the health sector. So in terms of our health sector members, we've got just over 100,000 members, and we actually represent people that work in a huge host of different health sector roles, both in the NHS and in private third sector not-for-profit organisations. And we represent members from the lowest to the highest bands and beyond. In terms of the way that we structure the health sector, we've got a few different professional organisations. The one that you'll probably be most interested in is the Community Practitioners and Health Visitors Association, that's CPHVA. It's an organisation that's been in existence since 1896 and represents the vast majority of health visitors, school nurses, community nursery nurses that work in health services across the UK. And like I say, has a long and proud history for doing lots of work, not just in terms of those professions, but also in terms of the health service and arguing for improvements that need to be made. I've also included the Mental Health Nurses Association logo there, just because that's an organisation that I do lots of work with now in Unite, and some of the stuff that I'll be sharing with you today is from that the work that I do there. The other thing that I wanted to mention about CPHVA, if you're not already student members, is that it is a really important organisation to be part of, not just because of the stuff that we'll be talking about today, but also because of access to the Community Practitioner Journal. That's the journal that comes out every couple of months and is a really good resource in terms of updating with everything that's going on currently for your professions. The other thing that's really helpful about it is not only do you get the journal printed and sent through the post to you, it's also available online, and as a member you can access the past archive online. So obviously, again, a really, really good resource for you to take advantage of. I just wanted to share another thing that we're doing at the moment. This is something that I've been involved in, and it's called the Mental Health Podcast. It's just something that we've been doing to kind of highlight a range of different issues that are of importance to our health sector members. This one I've highlighted is one that I did a couple of weeks ago, and it was linked into the Infant Mental Health Awareness Week. I interviewed, some of you may know Jenny Harmer, who is a health visitor based down in London, and she's one half of the I Am a Health Visitor podcast. I'd encourage you, if you've not subscribed to that podcast, to also subscribe to that podcast, because it's a brilliant resource. And obviously, in terms of podcasts being free, it's a really good opportunity to find out lots of information about what's happening. So if you could just look those two podcasts up, the Mental Health Podcast and also I'm at HV, and obviously, you know, subscribe to both, that would be great. Before I started properly today, I just wanted to give you all a bit of a health warning. And that's to say that obviously when we talk about, obviously the subject of today's lecture, the politics of anything, you've got to remember that people come to it and from it with their own kind of political biases or their own personal biases. I'm sure as we're talking through today, you'll pick up on some of the biases that I've got. Some of you may agree with them, some of you may disagree with them. It's actually quite healthy for us to have those disagreements and those conversations, because if we all believe the same thing, then I think we'd all be living in a very different country to the one that we live in now. And I think we would all, you know, suffer because of that. I just wanted to share a couple of pictures that I took during the last election. Obviously, it's a few months since that, quite a lot's changed since then. But I just thought it was really interesting that at one point during the election, you may have remembered that the Conservative Party changed their Twitter handle or their Twitter kind of name to Fact Check UK, and tried to present themselves as an organisation that would fact check Labour's comments. And obviously there are some excellent fact check organisations out there that do important work to kind of verify and check with the statements that are made both online and in media. And just one example of those a few days ago was there was a tweet that was being circulated quite frequently saying that the rate of suicide had increased, I think, by 200% during COVID-19. That actually wasn't based on any kind of factual information. It's, you know, it's not, we believe it's untrue because the data's still kind of coming in, but it certainly, you know, doesn't appear to be true, and had just been kind of, you know, created by someone, and that actually could create some real damages for people. You know, fact check organisations can kind of, you know, be that trusted source to be able to say, no, actually this isn't fact checked, this isn't accurate, and you should take these claims with real consideration. Obviously, having said that, today's lecture has been Fact Checked UK from me, so everything that I say is obviously amazing and hopefully will be really interesting, but obviously if it's not, I apologise that in advance. I think at this point as well, it's important to kind of talk about why politics is important. Some people, when I kind of say, you know, are you involved in politics? Are you interested in politics? Would kind of say, no, it's boring. It's not a subject that I ever want to kind of get engaged in. Some people would say, actually, we should sort of divest politics and health. You know, we shouldn't have the two sitting in the same space. You may be unsurprised to hear that I would disagree with those comments. And I would be very kind of strong in terms of saying that it's a real requirement for all of us to be involved in politics as health professionals, and it's a real critical issue for us to do that. And in terms of the principles of health visiting, and certainly for those school nurses on today's lecture as well, to consider this as well, that one of the principles talks about influence policies affecting health. And actually that real argument that if we as health professionals, and certainly as specialist community public health nurses, aren't influencing policies affecting health, then A, we're not going to be able to do our job very well, and B, more importantly, the job that we do on behalf of the clients, the members of the public that we come into contact with, will be much less you know, effective. It won't have the impact that we need it to have. And I think if you just think about some of the huge issues that have happened over the last few years, and the kind of real sort of changes in terms of politics and how that's impacted our health, you know, just thinking of one of them in terms of the smoking ban and about, you know, people not being able to smoke in you know, in places, in pubs, in shops, etc. And that has probably had one of the most significant impacts on our public health. And yet that wasn't achieved by individuals, that was achieved by a state stating what should happen for the benefit of everyone's health. And again, that's just one of the examples that we've got, and there's lots others that are happening at the moment. One of the dangers of me speaking is that I often go on to segues to kind of talk about subjects that are kind of related and then have to do the handbrake turn to come back in. But just to do a segue now, I think one of the classic examples of what's happening at the moment is with Boris Johnson's kind of comments about obesity. You know, previously to his catching COVID and being rather unwell with it, he was very kind of dismissive of national plans to reduce obesity, you know, the stuff that was going on with coming up with an obesity strategy. And certainly in my experience of having been involved in some of the discussions around that, seeing the weakening of the obesity strategies that came out previously. Now he's had COVID and he's seen the impact of his own overweightness on his recovery. He's kind of recognised that and said that, you know, more must be done. And again, that kind of bit about it's interesting how we change our politics and our approach when we experience something ourselves. And again, that's a really important message in terms of the work that you'll do as health professionals out in the public sphere, that it's really important that you get the views of other people to influence how you influence policies. Because if you do it through the prism of your own experiences, if your own experiences are quite dissimilar to the people that you're looking after, then the benefits that you bring may well not impact positively on the people that you care for. It may impact positively on you, and that's obviously a really important subject, and you should think about how you can get improvements for yourself. But in terms of the work that you're doing as a health professional, it's important that you kind of see it through their eyes. And certainly thinking back to the Infant Mental Health Awareness Week that was a few weeks ago, the actual theme of that week was on seeing the world through babies' eyes. Again, I did a podcast about that, talking to one of the people that has been involved in bringing the week to fruition, and asking whether we see the world through babies' eyes, and do politicians see the world through babies' eyes? And it'd be interesting to get different people, your feedback on how you think that's happening. And if you've got any comments and you want to put them in the chat, then please do. Just to know, I'm not looking at the chat at the moment, but it'll be certainly interesting to look at that later on. Right, so I just wanted to talk for a few minutes about what does the NMC say about all this kind of stuff, because obviously in terms of the work that you do, it's important that we all can work to the NMC code. I'm an NMC registrant myself. In terms of having a view about things and about being involved in the politics of things, the NMC talks about promoting professionalism and trust. I've just pulled out the heading of that section, and it goes into a bit more detail, stating that we must uphold the reputation of your profession at all times, making sure you do not express your personal beliefs, including political, religious or moral beliefs, to people in an inappropriate way. You may have kind of seen where that's happened before with colleagues in the past, but obviously as a health professional, you wouldn't be going and sort of forcing your political beliefs on anyone that you care for example. And sometimes you may come across people who are patients who you have different political beliefs to. It wouldn't be appropriate to kind of try and convince them the opposite when you're delivering care. It wouldn't be appropriate to do that. Just moving on to something else that the NMC does say, however, and it's this bit about often you can't just look at things in isolation. So if you thought about the previous slide and how you shouldn't express your political views, what does it say in terms of preserving safety? Now, it's got a few bits that I've pulled out. One is to act without delay if you believe that there is a risk to patient safety or public protection. And then also raise and, if necessary, escalate any concerns you may have about patient or public safety or the level of care people are receiving in your workplace or any other healthcare setting, and use the channels available to you in line with their guidance and local working practices. Now, obviously, the point I'm making here is the bit about how can you not raise concerns about how care is delivered if you don't have a political nature to the way that you discuss things. Again, if you're in a situation where you've witnessed poor care to an individual, what I'm not saying today is that you should be going on Twitter and tweeting about how disgraceful that care has been to the individual. There's obviously organisational ways to respond to poor care, and there's ways that as a trade union we can help our members highlight concerns around poor care. But there's also things about the wider healthcare service and the way that we deliver services that if we don't, as people working in those services, raise those concerns with the powers that be, the politicians, the people more senior to us in organisations, then how can we argue that we've discharged our duties appropriately in terms of preserving safety? I think one of the strong examples that we've got that's happened over the last few weeks and months is the failure of some organisations to give appropriate personal protective equipment to its employees. And obviously, if you haven't got any routes to raise that beyond the person that's saying no, then how can we make sure that those things are improved? And that's not just for the benefit of our members and you as individuals, but also for the benefit of the people that we care for and that we go home to at the end of the day, but also for the benefit of the people that we're delivering services to. And again, you know, the NMC goes further in the code to talk about how we shouldn't be doing things that put people at risk. If we're unable to make a service safe, then that's putting people at risk, and that's why we do need to raise concerns, and we need to be vocal about doing those things. I've also put this on the presentation because I thought it might be interesting and helpful. It's more related to when we had the general election and the period of PERDA that happened in November and December, and it just went into detail about how staff can raise concerns and sort of, you know, politically operate. And the underpinning guidance that NHS England and NHSI gave out was that the day-to-day operations of the NHS must continue unimpeded. As always, the NHS must act and be seen to act with political impartiality. And during the election period, democratic debate between candidates and parties should not be overshadowed by public controversy originated from NHS bodies themselves. Obviously, there was quite a lot of health controversy in the last election, but that shouldn't be kind of generated by the services themselves. It did also talk about staff activism though, and the NHS employees are free to undertake political activism in a personal capacity, but should not involve their organisation or create the impression of their organisation's involvement. And sometimes it can be as simple as saying, you know, I can say as a health visitor that I am concerned about cuts to this service, but not as an employee, as a health visitor that works for this trust. So again, being, you know, clear about the delineation of the roles that you have. I also thought it was interesting at the time that there was a tweet that came out, and this is from Alistair McLellan, who is the Health Service Journal's editor. And he commented on the fact that he'd seen emails that had kind of threatened staff that they shouldn't even like tweets because of PERDA. Obviously, from an organisational account, that would be quite reasonable, but also that kind of implication, it being from personal accounts. And again, what was interesting is that over 110 people had liked that tweet within 17 hours. And looking through that, there was quite a few likes from people that worked in the NHS. So obviously they hadn't taken that threat seriously, and I was quite pleased that they hadn't. It's also important to think about social media. I've mentioned it a few times today. Obviously, in terms of the world that we're living in at the moment, it's certainly become an even more important forum in terms of staying in touch, in terms of sharing messages, and in terms of our activism. Obviously, we've seen the world change quite dramatically due to COVID-19, but also due to the killing of George Floyd in America and other kind of real tragedies that have been perpetrated, sometimes by the state towards its own citizens. Social media is a hugely effective way of sharing that, and it's really important that, you know, as health professionals, we use it, but we also that we use it appropriately. And the NMC do have guidance on how to use it appropriately, and I would encourage all of you to consider reading it, even if you've not got social media accounts, you know, but do, you know, if you do have them, absolutely, it should be a priority to read it, just so you can check that you're not doing anything that is inappropriate that will cause problems. And certainly we've seen that the numbers of people being referred to the NMC for concerns around practice related to social media have certainly gone up more recently, including, I believe, during COVID-19 crisis. Now, I don't know how this is going to work now. Has everyone got access to the chat function? Let me see, can I see it on here? I don't know if I'm going to be able to see it now. I don't know if I can. Right, so we'll just have to play this game at home, which kind of does take away a little bit from it, but it doesn't matter. So when I do this in person, one of the things that I want to kind of ask is whether people know who are, you know, important people in politics. So here's the first one. Hopefully you will all know that that is our current Prime Minister, Boris Johnson. Let me go to the next one. Right, Now, when I usually ask about this one, lots of people don't know who it is. And yet he has had a hugely influential part played on the health service as we know it in England at the moment. For anyone that doesn't know, this is Lord Andrew Lansley, and he was the Health Secretary 3 times ago, and he brought in the Lansley reforms, which were hugely seismic kind of alterations with how the NHS worked in England. Certainly, as a critic, I would say it was hugely damaging. And actually, what we've seen with the work that Sir Simon Stevens has done over the last few years, I would argue, and I think a lot of people would agree, has been to undo a lot of the damage that he caused, but in a way where it's not looked like he's been doing that. And I think that has been with the complicit kind of agreement with people in power now, that I think they recognised that it was really highly kind of damaging the changes that happened through the Lansley reforms, and it's been easier to get rid of them, but not to admit that that's what the Conservative Party did at that point in time. Now, the next one, it's interesting because the last time I gave this lecture was, I think, in November, so I've had to update this slide a little bit. It'd be interesting to know how many of you know that this is Keir Starmer, who is now the leader of Her Majesty's opposition, leader of the Labour Party. Now, it's really difficult to be an opposition leader in terms of getting your face well known and recognised. And it's been kind of recognised that during COVID-19 that's even more problematic. But I think that the kind of opinion polls seem to be suggesting that he's done a relatively good job to get his face out there. So it would have been interesting to know how many people recognised him today. Now, these two, again, updated since the last time I gave this. So today's iteration, we've got top left of the two, Sir Ed Davey, and bottom right, Mark Pack. And they are both the co-joint interim temporary leaders of the Liberal Democrat Party. Obviously, they're working through a leadership election at the moment, and I'm sure there'll be a new photo there. I'm not actually sure what the deadline and timetable is for that election, but it is being held during COVID-19. They've not delayed it because of the current crisis, which I think is quite sensible in terms of how long it's continued for. Now, again, it would be interesting to know how many people recognise this gentleman, Jeremy Hunt. He is the last health secretary. He was actually the last ever health secretary in terms of it's now the health and social care secretary. So he was both the last health secretary and the first health and social care secretary that we had. And also he was the longest standing health secretary that the country's had. He had that role for a very long time. And if you look at the period of the Conservative Party's rule over this country, we've had 3 health secretaries so far. Whereas if you look to the previous period of Labour, I think they had 5, 6 or 7. They were much more rapid in terms of health secretary turnover. Now, it would be important to know about Jeremy Hunt's existence just in terms of the role that he played and the work that he did as Health Secretary previously, but even more so now that he has become the chair of the Health and Social Care Select Committee. Previously, that was a role that was held by another Conservative MP, and I can't even remember her surname, Dr. Sarah Wollaston. I'm saying thank you, that came back to my head. The chair of a select committee has a very important role because they have to kind of monitor and hold the government to account on that area of health, on that area of policy. If you look at the Health and Social Care Select Committee's website, you can see a list of all their current and previous inquiries. And in terms of the work that you do, there's been quite a few that have been highly relevant to those roles. So it's a really important place to look and to see the kind of debates and discussions that have happened. And we often go to those events. It's easy to, well, those events are now held virtually, but when they were held in person, they were always live streamed as well. So they're a really good opportunity to get sort of top-notch information about what's happening in terms of health policy. And you can sign up on Twitter. Obviously, they've got a a Twitter handle, Commons Health. And if you put that in and make sure you get alerts when they've got any tweets going, you can hear about sessions in advance and hear about what different witnesses are saying at the hearings. And, you know, it's absolutely important stuff that's discussed there. So next we've got John Ashworth. He is the Labour Shadow Health and Social Care Secretary. So he leads for the Labour Party on all things health and social care, and he has been a huge advocate and supporter of 0 to 19, 0 to 25 services, and spoken really articulate in a really articulate way about concerns that we have around cuts to the services that you're all going to be entering into hopefully soon. Important person to know about and to follow and to think what he's saying and to you know, to absorb that. Now next we've got someone that's become even more famous during COVID-19, often appearing on the daily press briefings, and had lots to say, quite rightly, about the stuff that's happened over the last few months. Matt Hancock, relatively recently new in post as Health Secretary, and obviously again someone important to follow and to listen to the information that he has been sharing, and we'll hear more from him later, as I've got a clip of something that he said later in the presentation. Now I've also put up this lady MP who is Nadine Dorres, and she leads on mental health, someone that I obviously try and keep a close eye on in terms of the information that she's sharing, and obviously in terms of the work and roles that you'll be performing, someone else to make sure that you follow for the time being while she's got this role. And you know, it's important to think about the things that she's saying. Next, another couple of women. We've got Ruth Mae, who's top left. She is the chief nurse for England. Again, you may have seen her on some of the broadcasts that were done around COVID-19. But interestingly, after not being willing to back up Dominic Cummings' story, allegedly, she wasn't seen on any future daily press conferences. So she is the chief nurse at NHS England and NHS Improvement, so kind of the most senior nurse in England. Bottom right is Viv Bennett. She holds the same role, but at Public Health England. So some would argue that she is the chief nurse for school nurses and health visitors. And again, it was interesting. I was doing some tweeting the last couple of days about one of the situations that I'm dealing with in one of the trusts that I support via our regional officer. And someone commented back saying, you know, health visiting and school nursing would be in a much stronger position if we had a chief nurse. Again, you know, arguably we do have one. And, you know, whether the value that chief nurses bring, you know, obviously probably changes day by day. But obviously they've both been hugely busy during the COVID crisis that we've seen. Now, this person, I'm kind of expecting that the vast majority, if not all of you, won't know who this gentleman is. This is actually Johnny Reynolds. He is the most important MP on this slide, and he's the most important MP on this slide because he's actually my MP. And the reason why I would argue that he's the most important is he is my voice in terms of the stuff that's happening in Parliament. I say my voice, it's not his role to be my puppet, sadly, and MPs don't have a role of having to conform with what their constituents want them to do. They're someone that doesn't kind of have to do a poll for any issue and then go and replicate that decision in Parliament. They are very much their own people, but obviously elected to represent my constituency of Stalybridge and Hyde. Now, I say it's obviously the most important for me because, you know, it's my opportunity to have my voice heard in the House of Commons. If you don't know who your MP is, then I would absolutely encourage you, whilst we're talking today, to have a quick look on the internet and find out who this person is. You can find out either by going to the Parliament website or also going to a website that's called They Work For Me. It's really a helpful site, including that you can you can see the voting history of your MP, and you can also sign up for alerts. So every time Johnny speaks in the House of Commons, every time he asks a written question. Every time he votes, I can get an alert that tells me that he's done that. You can also get daily alerts, so it's not as many emails that you get. And it's just really helpful information in terms of being involved. You can also sign up for alerts on that website. They work for me around different issues, so you can put in keywords. So if anyone wants to follow their own profession, it's really helpful to do that. So I have alerts for health visiting, for example, as my profession, and it's useful to see when those two words are mentioned in Parliament. Now, funny enough, I had a look at that before doing this session today, just to see how often health visitor had been mentioned in Parliament and school nurse. And it's not a hugely used term, but as you'll see, since the start in the 1800s up to 2020, it's certainly been mentioned more often. Same situation for school nursing. Probably argue that school nursing was mentioned a little bit more previously. One of the failures of this is that if you have health and visitor in the same kind of section, then it'll pick up on those. So it might not always be direct mentions of our professions, but it's it's something helpful to have and to know about. And certainly I've picked up on some important debates that have happened because of having those alerts set up. Now, I'm hoping this will work now. We're now going to talk about numbers. And one of the reasons that I talk about this is, for some of you, you may be aware, and maybe all of you, about the health visitor implementation plan that was brought in sort of early 2010s. And that was a piece of work that took a lot of effort to get running, and I'll talk about that later. But I just wanted to give Matt a few moments to share a message that he shared, and this was in November, just before the last election. I'm hoping this now works.
Great news just out that there's a sharp rise in the number of doctors and nurses in our NHS. And since 2010, we've seen 20,000 more doctors and 10,000 more nurses on our wards. There's more to do, and we're going to put the record levels of investment into our NHS. But these figures show that there's progress in hiring more people to care for us and to ensure the NHS is always there for you and your family.
Okay, well, hopefully you heard Matt there. If
Great
not,
news just out.
Oh, there's him again. Here's kind of a similar message that he shared just less than a week ago. And this was a tweet that he shared on the 25th of June. Good news on the NHS just out. Record doctors 6,000 more than a year ago. Record nurses 12,000 more than a year ago. Well on our way to delivering 50,000 more nurses by the end of the Parliament. The reference there to 50,000 more nurses, you probably will all be aware that during the last election, one of the pledges that was made by the Conservative Party was that we would get 50,000 more nurses. So obviously now they've been elected to government, then that should be something that they're working towards. And certainly some of my work relates to that target and supporting the work that government's doing to try and achieve that. Because obviously 50,000 more nurses in England would be a hugely beneficial thing to our society. Now, in terms of numbers, we're going to kind of come back to that discussion in a bit. I wanted to sort of flip back to the discussion that I started around health visiting, and just to share this slide with you. Sort of in the late 2000s, there was a real issue around health visitor numbers, where we were seeing quite a rather rapid decline in the number of health visitors. And that kind of resulted in quite a lot of pressure that we and others placed on the then government, arguing that we had a real kind of concern and a real problem brewing. Now, there's 4 documents that I've got on the left side of the screen that may be of interest. The first one was at the Family and Parenting Institute, which is an organisation that's kind of changed to something else since then. It merged with another organisation and changed its name. But back then it did a piece of work called Health Visitors and Endangered Species. And what that looked at was the number of health visitors across England and compared it with the primary care trusts. They were the kind of the organisations that delivered health visiting services back then. And they did a ranking system where they kind of looked at the 150 plus organisations and found how many health visitors per child, or how many children per health visitor were in the best organisation and how many were in the worst, and had the list in between. It also did some survey work and talked to parents about their experiences. And what that found was that back in the late 2000s, that health visitors were very kind of invisible, that parents didn't really, you'd maybe say, oh, well, I had one with my first child, my second child, I've never seen them. People that had never had a first, they were on the first child at that point were saying, well, I've not really seen my health visitor much, and concerns about that. That went alongside a piece of work that NetMums did called Left Fending for Ourselves. And that again surveyed parents about their experiences, and just found that parents were very much just being left to deal with parenting completely alone. And obviously that was causing huge problems in terms of their health and well-being, and also the health and well-being of the children. Interestingly, at that point, the Conservatives went into their 2010 election arguing that they would invest in health visiting. And there was this Conservative document called Helping New Families. And they talked about increasing the number of health visitors by bringing them into sort of getting 4,200 more health visitors, but they would be Sure Start health visitors. And what was interesting at the time was the kind of the Labour argument was that the Conservatives were going to defund Sure Start, which was an initiative that Labour had put a load of money in the 2000s. But the Conservatives kind of argued that they would redirect that money into health visiting, and they would have Sure Start health visitors to kind of keep that link going. Other things that happened at that time were the killings of Victoria Climbié and baby Peter Connolly. Very young children who had been killed while under the care of their caregivers, and it was quite clear that the services that they received just didn't pick up on the issues that were at play. And it wasn't that these were forgotten children or invisible children that had been killed. It was very much that they were in the view of lots of different people, but how that information was brought together and these children were protected and kept safe just didn't happen. I've put that plus there on CPHVA because, again, that kind of argument about the politics of these things, things go wrong. Things as we saw in terms of the provision of health visiting services, their numbers went down. And it takes a lot of effort to put arguments out and to try and make things better. And lots of organisations did that in the 2000s to argue that things needed to improve. Now, this is another slide that would normally try and get some audience participation in. Again, not that successful today, but it kind of just highlights a few different things, charts, and it starts on the left of the screen in the 2000s, and it finishes in 2015 on the right of the screen. Now, a few different things that it's showing. It's showing the number of nurses and health visitors in total. It's showing the birth rate. It's showing the children under 5, and it's showing the number of health visitors. Now, if you just have a few seconds to look at that and think about which lines show which thing. It started with a baseline in the 2000 and it's percentage up and down. So you've got 10%, 20%, 30% more or less, depending on if you're above or below the axis. Now, I'll take away the bit at the bottom. You see there, maybe some of you will have guessed that the graph that went down significantly to 2011, that's the number of health visitors. We obviously got the health visitor implementation plan announced. Then by 2011, there was a reverse in the number of health visitors. And by 2015, by the end of the plan, we had a trajectory to achieve over 20% increase from the number that we had in 2000, which was kind of like a 40% increase since the worst case in 2011. Now, one of the reasons why this slide is really, really important is even though it doesn't show the picture since 2015, it does kind of highlight a really important fact. One of the arguments that I had with people in 2013, 14 and 15 was that after the health visitor implementation plan was achieved, we wouldn't really need to worry about health visiting anymore, because we'd seen this massive investment and this massive increase between 2011 and 2015 of 40%, and therefore we could sit quite pretty and happy. But what you need to do is take it in the context of the other lines on this graph. So if you look, for example, of the live births in England and Wales, even though there was a bit of a drop in 2013, that's been something that historically has gone up and up. And certainly in terms of the 0 to 4-year-olds, we've seen the same. So actually, if you kind of link the lines up, you'll see that even with that 40% increase, because we saw that massive drop between 2000 and 2011, even with the massive increase that we've seen, we were only marking time with the situation that we had in 2000, and that was hugely problematic. So not just about numbers, but again, this is bringing this picture a bit further up to date. What you've got here is the full-time equivalent health visitors in England, and I've subdivided it up into the 3 sections dependent on which was the health secretary at the time. Obviously, Andrew Lansley had quite a flat kind of situation. We saw the massive increase from Jeremy Hunt's time, but also the massive decrease. So he kind of presided over a huge mountain going above his head, but it quickly came down again. And then we've got Matt Hancock more recently. Obviously, the situation since Matt Hancock is that we've now got a worse situation than we had in May 2010, and that was the situation before the Health Visitor Implementation Plan. Just to talk about some of those figures, so between May 2010 and March 2020, there's been a cut of 1,051 health visitors in the NHS, and that's 13.3%. Now, that's obviously important, but one of the counter arguments that people can give is, but the commissioning of health visiting is now done by local authorities, and that commissioning has meant that health visitors are sometimes not employed in the NHS. And that is certainly true. Actually, since the end of commissioning from the NHS and the move to the commissioning in the local authorities, we've seen a 3,481 cut in the NHS, which is 33.8%. But what about those health visitors that are no longer employed in the NHS? Now, for the last couple of years, I've done a piece of work that I've called HV Re-Endangered. Obviously, that kind of harks back to the work that the Family and Parenting Institute did when they argued that we needed a health visitor implementation plan. And that just highlights the kind of the situation across England. So if you, I'll send some links after today's event to Jude, and she can circulate that info to you, and it'll include a link to the work that I've done on this topic. What you can do is find out what the situation was in February 2019, and it's got a list of all the local authorities in England, who employs the health visitors in each of those local authorities in February of last year, and the kind of situation in terms of caseload sizes with a very rough average for each organisation. What you find is there hasn't been a huge amount of health visitors that have been transferred out of NHS employment over the last few years. So actually these 3,481 cut isn't, everyone gone into local authority and no longer counted in the NHS figures. It certainly is, it kind of shows the bigger picture of the cuts that have happened. So I've said a lot about health visiting today, and apologies for that for those of you in the room that are school nurses. I talk a lot about health visitors because that's my profession and my first love, but school nurses, it comes a closer sort of second to that. Because obviously you do a hugely important job as well. And you didn't get a health visitor implementation plan, a school nurse implementation plan, although CPH very long argued for one. We did some research when the health visitor implementation plan was happening to kind of show about the huge problems that school nurses were facing, and especially qualified school nurses in terms of the huge caseloads that you were facing. We've always argued that each school nurse should have a secondary school each, and there should be school nurses that have a cluster of feeder primary schools each. So we kind of say about 6 feeder primary schools. I'm sure none of you will recognise that as a reality, that the school nurses that you work with will have much more demands on their time than those numbers. And obviously the argument that we make about that is that if you cannot have time to support schools and children at those schools directly, then all you become is people that work in child protection, and you kind of look at the top end of stuff, and you can't be involved in early intervention and supporting people so they don't go into that crisis. And it'll certainly be something that we'll continue to argue for, and hopefully you'll join us in arguing that we need much better provision of school nursing in England. In terms of the picture, we have seen a drop as well in school nursing. So between May 2010 and March 2020, there's been a cut of 216 qualified school nurses, and that's 19.4%. And since the transfer of commission to local authorities, for school nurses that happened earlier because it was recognised that health visiting needed to be held on to longer because of the implementation plan. There's been a cut of 209, which is a 18.9% cut. And again, it's hugely problematic that we've seen that we should be seeing the absolute opposite. And certainly if you look to the response that we submitted to the government when they brought out their children and young people's mental health plan a year or so, a couple of years ago, we argued at that point again that we needed to vastly increase the number of school nurses rather than bringing in other new professionals to do that work in schools. And we argued that school nurses were perfectly placed to be the leaders of that work and should be supported to be it. But again, the government came up with a very education-focused system that was hugely frustrating. Now, I've also put on this today, this is the number of mental health nurses, because I just wanted to kind of show the diversity of professionals that have been significantly cut since May 2010. And again, you know, that's the important thing to recognise when we hear Matt Hancock, Boris Johnson et al. Talk about the increases that we've had in nurses. And I'll talk about that as a global figure, I think, on the next but one slide. What we've seen in terms of mental health nursing is between May 2010 and July 2019, there's been 4,602 mental health nurses cut, that's 11.3%. And actually, over the last few years, looking back at the slide, you'll see that there has been a slow general improvement in that, which is hugely welcome. But it is so slow that when I looked at these stats for up to July 2019, it was only a 655 net increase between July 18 and 19. And if that increase was repeated year on year, so if we carried on getting 655 more net per year, it would take us till 2027 to get back to the situation in terms of the number of mental health nurses that we had in 2010. And again, you know, these figures of 50,000 more nurses, we've really got to kind of scratch that surface and not allow politicians just to use it as a kind of an argument to win the population over about what an amazing job they're doing. And just to give you a bit more information about that, again, you know, not just being about the numbers, this kind of shows you the situation in terms of population growth between 2010 and 2019. So whilst total nurses and health visitors as a combined has increased, and this is the message that Matt was sharing on that tweet before and in that video that he put on Twitter, there has been an increase of 20,431 nurses between 2010 and 2020, or 7.3%. The population of England has actually increased by 3.64 million, and that's 6.9%. The population of 0 to 5s has increased by 2.6%, and the population of 5 to 19s has increased by 6.3%. So if we kind of look at that in a slightly different way, if you look at all nurses and health visitors between May 2010 and 2019, in 2010, there was 187 people in England per nurse, and in May 2019, there was one for every 194. If we look at health visitors, in May 2010, there was 494 children 0 to 5 for every health visitor. By 2019, that's increased to 564. And this is a really eye-watering one next. In May 2010, there was one school nurse for every 8,435 5 to 19-year-olds in England. By May 2019, there was 11,127 5 to 19-year-olds per qualified school nurse. I've also done the figure for mental health nursing, For mental health nursing in 2010, it was 1 per 1,296 people in England, and by May 2018, there was 1 for every 1,555. So again, you kind of see that even though for some of these professions, certainly the first one in terms of nurses overall, we have seen an increase. When you compare that with the population, the increase has either been minuscule or non-existent. The other thing that's really important to remember over this period of time is that we will see lots of shouting about how many more nurses we've got in nursing today. And one of the reasons that we've seen that is that data up the NHS digital sharing now goes up to March 2020. And you'll remember that the COVID kind of crisis started seriously in 2020, in March, but we knew about it in February and the end of January. And those people that returned to the nursing register for the response to COVID. And I was one of those people that, I went back into working on a ward, rather, short-lived, but I am sure have been counted in the new figures that are showing that we've got more nurses. So again, when it comes to politics and what politicians say, and when you fact check things in your own heads, it's important to kind of think about the context of the things that are being said. And in terms of the context of this, we've seen that they've gone up, but it may well be a response to COVID. And obviously that isn't, we don't want to get to the next election and the government to argue that they got 50,000 more, but the 50,000 were partly because of COVID, and those people left very quickly, but to still count them. The other thing that was interesting was when the Conservative Party announced that they would have 50,000 more nurses, there was a leak that was reported both in the Health Service Journal and the Independent newspaper, and that highlighted the kind of the work that was being done by NHS England, NHS Improvement, to increase the number of nurses at that point in time. And it was kind of talking about using nursing associates as a kind of, for every nursing associate, that would cover a third of a nurse, I think it was kind of suggesting. So again, that bit about when the government promised 50,000 more nurses, it should be 50,000 more. And again, at the time, there was this discussion about what's a new nurse? Is it a new nurse that's been trained and got out the other end, or is it a new nurse that has been encouraged not to leave and therefore they're a new nurse? And again, some government ministers got quite mixed up on that topic when it came to some GMTV appearances. I just wanted to widen it out to some other discussions about politics, and again, but this still being relevant and related to the NHS. The Conservative Party in November shared a video of Boris wandering through an office back in the time when we could sit next to each other in offices. They bumped into him on his tea break, and he had this monologue where he kind of talked about the massive investment that the Conservative Party promised for the NHS. It would be the biggest investment for a generation, also massively in schools, in policing, 20,000 police, we kind of argued that would come along. If you look at the chart on the right, you'll actually see the annual growth rate and government averages in real UK public spending on health between 1979 and 2016. And you'll kind of see that actually we did have record investment in my generation in the late 1990s, early 2000s. And that was obviously done by the Labour government at the time. The investment that we're seeing in the NHS under first the coalition and then in Cameron's government was really minuscule when you compared it with the levels. And actually the investment that Blair and Brown needed to put in the NHS was desperate because of the underinvestment that we'd seen previously. If we'd have seen a reasonable investment over, from the late 70s forward, the argument would be is you wouldn't have needed to have pumped as much money as was needed in the 2000s. Obviously, we got the financial crash in 2008, and I'm going to talk about that in a minute, so I won't get diverted to that now. But one of the things that I did want to highlight as well is I shared a tweet earlier this week. Fascinating that Boris Johnson has argued that the the education budget will be increased by 1 billion, and that this would be a massive increase. Because actually 10 years ago this month, I think it may be 10 years ago today or tomorrow, Michael Gove cut £1 billion from the education budget. So again, that kind of bit about, you've always got to consider when politicians talk about huge investment, actually, is that huge investment? What is the reality? Is it not as obvious as they suggest? This was something from a reputable fact check website, health spending Conservatives compared to last Labour government and long-term trend. And obviously what you see there is that there was a huge increase again with the Labour government, and the actual spending growth under the Conservative Party has been much less than the average because of the way that the Labour Party pulled it up. Now, I was going to go on to this bit, and obviously I cut myself short. Some of you may have heard of a term called fiscal multiplication, or you can also term it kind of, where do you offshore your money? Now, there's this really good book, The Body Economic. If you are slightly interested in the issue of spending on public services, especially healthcare, then do get yourself a copy of that book. And I was really interested when it came out just after the economic crash in 2008, and kind of went into the details of the fiscal multiplier. So the fiscal multiplier is an estimate of how many dollars of future economic growth are created for each dollar of government spend. Obviously, it's in American terms, it's described here. So when a fiscal multiplier is greater than 1, it means that government spending has a multiplicative effect. So for each pound of government spending creates more than £1 in future economic growth. When the multiplier is less than 1, it means that each £1 of additional government spending is destroying the economy. So it's taking away from the economy, creating inefficiencies or taking away money from the private sector that would be better to boost the economy. The other thing that the book talks about, and that's a really important issue and kind of fits in with this fiscal multiplier effect, is how in 2008, all the biggest banks failed. And it talks, the stock market crashed by 90%, investments worth 9 times the country's, and this is sort of relevant to Iceland. So investments worth 9 times the country's annual economic production disappeared within 1 week in October 2008. And what was interesting was the Icelandic, their response to the crash was the Public Health Institute asked local journalists to write more positive stories in an effort to curb the risk of suicide. And as Bloomberg Financial News reported, this was no post-Lehman Brothers recession. It was a depression, and a huge depression. And we're all still living with the austerity caused by that depression. Across countries, the average multiplier effect of public healthcare spending has been about 3.6%. So this is thinking about healthcare in itself. For every £1 that's spent on public service, for every £1 that's spent on public healthcare, they get about 3.6% back. So a 360% increase in the money, in terms of an interest rate. And there's information there about kind of the different levels in America. Unfortunately, there's no national NHS specific estimate at that time, and they've been able to identify, but from studies, they reckon that NHS spending, for every pound that we spend on the NHS, there's a range of between 2 and 4 times the increase. And again, this is really important in terms of when people argue about how, with the austerity that we saw over the last 10 years, and what will happen next in terms of how we will respond post-COVID and all the money that's been spent on COVID. If you cut from things that have a fiscal multiplying effect, not only does it harm actually those services themselves, but it also has a wider impact on society and causes us more problems further down the line. And, you kind of see Boris Johnson saying that, you're not allowed to mention the A word, austerity word anymore. But then a few days ago argued that austerity wasn't really austerity. Maybe not for the richest in society, but we do know for the poorest in society, austerity was hugely damaging. And again, the Body Economic book looks at it in the terms of a few different countries. So it compares Iceland, a country that was absolutely bust, it had no money left, and yet it had to make a decision on whether it would default on the loans that it kind of like taken out, or whether they would pay those loans back. And the country actually had a referendum and voted to default on those. And actually since then, Iceland has recovered remarkably quickly. If you compare that with Greece, a country that again was in huge amount of debt, but instead of writing off the debt, they decided to go to the IMF as the last lender of choice, and to take a huge amount of money, loans from them. And in taking those loans, they had to cut public services as a kind of a promise to be able to pay it back in the medium term. What was obviously interesting was when you looked at the impacts on Iceland's public health system and its health system, they actually found that people became healthier during and after that crisis. If you compared that with Greece, actually Greece's population became less healthy. And in terms of the numbers of suicide, you saw the rate of suicide increasing in Greece at that time. You also saw the kind of increase in things like HIV, because where there were preventative services like needle exchanges, they stopped because there wasn't the money to pay for them anymore. But obviously that stores up a bigger problem, because the cost of a needle exchange service might be quite low, but actually in treating people that had been sharing needles, who had then contracted HIV, is much more expensive and much more damaging. And that has a kind of a multiplier effect of itself, because those people can't have productive lives in terms of contributing to the economy, making sure that the country grows. It's kind of a really problematic impact. And again, the decisions that our country took in 2008, 2009, 2010, at first to kind of keep the banks going, but then to create huge cuts in public services. And one of the arguments that I've made repeatedly post-COVID, the impact of COVID, is that the NHS went into COVID not just facing a crisis of international public health, but also in terms of a national crisis of not enough staff. And we saw that in terms of the promises to have more nurses. And we've seen that services have been hugely stretched in our country. And I'm sure there's arguments to be made that the death rate, in our country, that's certainly one of the world's greatest, it has been caused by, in no small part because of the austerity that we've faced over the last 10 years. Go past that. I just wanted to give you another example. Earlier I was talking about how politicians will say that they're investing in things and it may look good on the page, but actually you've got to cut below that initial page and see what's behind that. There was talk in August that the government were announcing £3.3 million to help young people get mental health support. So that sounds great. Who would argue against that? But at the same time, if you looked at analysis by the Health Foundation, that showed that the grant, which was currently the 3.1 billion a year, so this was a local authority grant, is now 850 million lower in real terms than initial allocations in 2015-16, and with spending review likely to be delayed, key funding decisions that will face another real terms cut of £58 million in 2020-2021 under the provisional plans that were in place at the time. And that would be a 25% cut on the real term per head spend from 2015-16. So we've seen such a big amount of money taken from local authorities who have a real huge important part to play in terms of health promotion, public health, mental health. So with population growth factored in, £1 billion would need to be restored to the funding, to get funding back to 2015-16 levels. So you probably can't see on the right graph, but that's showing the investment on the left versus the cut on the right that have just been reported in the two pictures to the graph's side. And it just shows, a really good visual indicator of how £3.3 million is so tiny compared with the huge cuts that have happened certainly over the last 10 years. Another good example that's been often spoken about is that, we promised that we're going to get 20,000 more police officers. That's on the back of 21,000 police officers being cut since 2010. So again, that kind of thing about, you know, we've been promised more, but the more is less than what we had. I just wanted to also share these graphs, and what these do is they kind of compare the situation for our country versus lots of other countries. And obviously it's really important to know this when we think about the politics of health. If you look at the graph on the left, we've got UK health spending per person. And in the UK, that was around the median for OECD member states, and that was in 2017. The graph on the right, UK health expenditure as a share of GDP. Actually, the UK was the second lowest of the G7 countries in 2017. So one of the things that we often get told as public is that our health service is inefficient, it's expensive, and there's lots of places that do it better. I'm not going to argue today that our health service is perfect, because it's not. But for actually the amount of money that we put into the health service, it is hugely, amazingly good. And when people argue that we need to think about cutting and making things more efficient, it's important that we actually compare that with other countries. What's also really important to do is think about often the country that we seem to compare ourselves with and want to be friends with the greatest is the United States of America. That's not to argue that the United States of America isn't a lovely place. I do have real issues about its president at the moment, but you know, there's a lot of positives that come from that country. One of the things though is the fact that when we compare ourselves with that, they spend so much more in terms of the amount of money that they spend on health, and their health outcomes are mostly much less successful than ours. Just another couple of charts. The one on the left, the UK spent below the OECD median on healthcare, governance and finance. And again, that's really interesting because that's the bit about the back office stuff of health. And sometimes, you know, the argument is we need to privatise things because privatisation makes things more efficient. But actually, when you privatise something, you also need to do lots of other work in terms of chasing money, making sure that people are paying for things, you know, if it's in a poorly integrated system. And if you want an example of that, I would encourage you to read Sean Linton's piece that he did a few days ago about the situation that we've got with test, track and trace. And he reported on the situation where we brought in lighthouse labs into the NHS over the last few months to do test, track and trace stuff for COVID-19. And I think it's, you know, the argument can certainly be made that it's cost us more. The work has not been as good, and the problem that they've not shared that information with local authorities, who are then less able to respond to local crisis in terms of increasing outbreaks for COVID-19. Chart on the right, there's an observable association between higher health spending and increased life expectancies for countries spending up to £2,500 per person on healthcare. The UK is the yellowy spot on there, and I'll share the link for the graph so you can find out where all the others come. I'm sure you'll be unsurprised to hear that the spot that's way off to the right, I am sure, is the USA again. And again, what that kind of really says is that every time you spend a bit more on health, your population's healthier. So again, you know, as a public, every time we cut spending on health, it means that people are more likely going to, you know, be poorly and they're going to die earlier. And again, it's that kind of bit about why we do need to invest in our health services, because it has that direct impact on all of us. The other thing that I want to show is the thing about, this is practicing nurses per 1,000 population, 2000 and 2015, or nearest year. Again, what that shows is the UK is very much in the middle of the field in terms of number of nurses per population. If you go way over to the left, you can see that Switzerland has the best, and actually they've had a huge improvement in a 15-year period. So again, you know, when we think about cuts that we're performing on our health service, we shouldn't really be looking at cutting nursing because we compare, you know, relatively poorly with some parts of the world. Different categories of beds. This is on the left as numbers. So again, this is really important that when we talk about our health service and about its efficiency, we've actually had a huge cut in the number of beds that are delivering care. And certainly in terms of some groups, those beds have been cut even more markedly, and maybe for good reason. But again, when you compare that with other places around the world, you actually see that we're way below other countries, and I've just highlighted that graph there. This is for psychiatric hospital beds per 100,000. Members of the European Union, across is the spotty line, and the UK is the hard line. Again, maybe some of those cuts have been appropriate, that we've reduced institutionalisation of our citizens, but also that bit about how we invest, and when we're talking about people having to travel hundreds of miles to get a hospital bed to receive care, and then not being able to see their relatives, you kind of see why one of the reasons that will be. The other thing that I wanted to talk about today was universal credit. And again, this is something that has been hugely problematic. It was brought in a few years ago with trials, and it's been more and more widely rolled out across the country. And in 2018, we wrote to the then Secretary of State, Esther McVeigh, to ask them to stop and scrap universal credit, because it has a hugely punitive welfare conditionality aspects to it. So if you don't kind of conform with the system, the money is cut off and you are left destitute. Obviously, that kind of situation is argued that we shouldn't be giving money away for free. But actually, the benefits that we give people are to keep them from falling through that safety net. And what will be interesting post-COVID is how much people recognise that the credit system that we have in our country is really, really woeful. That it's not a situation that we shower people that are lazy with lots and lots of money. And we've seen through COVID that people have lost their jobs through no fault of their own, and actually having to wait 5 weeks to get money, having to go through systems to get that money, having to rely on the government bringing in alternative things to support those people, because all of a sudden people have recognised how poor the system is. It will be fascinating to see how much we retain our level of humanity going forward. And I think it is fascinating to compare the situation that we've had with COVID, that because lots of middle class people in COVID have lost their livelihoods, they've been supported, and quite rightly so, with a system, with the furlough scheme, that actually is a good scheme. Getting paid 80% of your wage at a time when you can't work is a hugely, an excellent safety net. Have we done that over the last 10 years? Well, we've not, have we? We've looked at the disabled, the poor, and we've made their lives, a real misery. And we've kind of seen that in terms of the excess deaths that we've seen over the last 10 years of austerity, and the kind of the response that we've had as a society. And I've just shared a few more kind of highlights of the universal discredit and the work that Ken Loach has done, for example, on I, Daniel Blake. And he's done something more recently on the gig economy. Again, it's really important as a society where we think about what kind of society we want to be. Again, you may feel that this has been quite, we've gone off topic today with the discussion, because obviously the first point was, the politics of specialist community public health nursing ? That you could think, well, why is this important? Why is it important that as health visitors and school nurses we have a view on these subjects? Hopefully you'll see the way that I've tried to thread this through, that it's really important that we have a role and we have a reason to be vocal about these issues, because the majority of families that you visit may well be on universal credit. They may be suffering because of the problems with the scheme. It may be having a huge impact on their ability to be good parents, because obviously if you're stressed about money worries, then you're less able to be available for your children. And there's a great organisation, the Money and Mental Health Policy Institute, that do amazing work, and I'd encourage you to follow them on Twitter, to talk about the links between mental health and money worries. Martin Lewis, the money saving expert who set up that organisation, he is very articulate on why we need to think very carefully about the support that we offer people. And COVID-19 will be an amazing test for us as a society in terms of, do we put our arms around people, or do we push them away? Do we squash them down? And again, you know, it may cost us money to put our arms around people, but if we do that successfully, then the result of that care and that attention and that support will be much greater and much more beneficial in the medium and longer term. The other thing that we have to think about universal discredit is the issue of food banks. And what we've seen is there's been this massive increase in the number of food banks. It's been sad to see that some politicians have kind of celebrated this as a sign of altruistic Britain, of you know, how amazing it is that people are willing to give food away. We should really hold the shame for the fact that you know, in between 2018 and 19, 1.6 million 3-day emergency food supplies were needed to be given to people by the Trussell Trust in food banks across the UK. And that number has dramatically gone up over the last few years. The other thing that is shameful is when people try to suggest that people use food banks or the benefit system as a way of kind of getting an easy life. In my experience as a health visitor, it was very hard to find families that were trying to game the system. In my sort of experience, it was so much more likely, on a probably 99 to 1, to meet families that were just desperately trying to do the best that they could. Whether they were in work or out of work, they genuinely wanted to be a good citizen, a good parent, and to do something good in life. And it's fascinating that we often think of people having much worse motives than ourselves. That I'm sure you all kind of sit there thinking of your own value of being a worker, of being someone that contributes something positively to society. It's really sad that we kind of then look to the poorest and to the disabled and to people in hardship and think that actually they don't have the same ideals. They don't want to achieve the same in life. And I would argue, contrary, that they're desperate to make positive contributions, and we should support them to do that. We should be, you know, that society that supports all citizens to be the best that they can be. And especially if they've got situations where it means that it's much harder for them to do that. I mentioned before Money and Mental Health Policy Institute, and this again links into the bit about why it's important to be engaged politically. Now, they've done some amazing campaigns around money and mental health. The first one that they did was around when someone has money worries, they can get a letter from a health professional that they can give to their bank that says, back off, give me some time, I need support to solve these money worries out. Some people were being charged up to £125 for those letters to be able to go to the bank and say that they're in financial hardship. So they did work around arguing how that was immoral and making that illegal, and we supported them on that campaign. More recently, they've been doing a campaign called Debt Threats, and I'd encourage you to look this one up. And this is this guy here, Jerome Rogers. He took his own life in 2016, and he was a guy that was a gig economy worker. He was a moped delivery person, and one day his moped was clamped, so he couldn't access it. He had to pay a fine to get the moped released. That then caused him problems with his rent with the local authority, and they started sending him really threatening letters about that debt. And what's interesting is if you look at the legislation, it actually demands that the letters should be threatening. And the Money and Mental Health Policy Institute have argued that that isn't a good thing, and that we should work against that, and we should again support people in debt. And again, you can have the kind of pejorative view that people in debt deserve what they get because they've run up debts, and it's so why should they get an easy life versus others? But when you listen to the stories of how people have gone into financial hardship, maybe it's that they missed a job centre appointment because of an illness, and they've been sanctioned in terms of the benefits, and they now have absolutely no money coming in, and they have to rely on credit cards to be able to survive for a few weeks. And then once the money does start, they can't pay off the credit card debt because that's spiralling out of control. And again, how important it is that we engage in the politics of all these discussions, and we argue that we need to be a kinder society. I also wanted to think about another example of where there's been real success, often out of huge tragedy. And this guy, Oliver Mcgowan, He was mildly autistic and had epilepsy and learning difficulties, and he died whilst under the care of the NHS. And his family have campaigned tirelessly to argue that there needs to be much better support for people with learning disabilities and autism. We've seen things slowly start to improve, and one of the real successes of the work that his mum did was to get a commitment from the government that every NHS and social care worker will receive mandatory training relevant to their role around learning disabilities and autism, so they can try and stop these tragedies from happening again. You may have seen Oliver's face in the news over the last couple of days, because they've also now won a campaign to get his death investigated by the police. So again, a positive news story out of a huge tragedy. And we owe so much, don't we, as health professionals, that people that are sometimes harmed by the services that we're involved in, who lose so much, fight to get things better for other people. And again, we should always kind of retain that humanity in the work that we do, and remember that the people that we look after have often complex and difficult stories to tell, and how it's so important that we support them, and so important that we think about how we can make their lives better, or we can learn from the mistakes that we make to benefit people coming after them. I also wanted to share the story of Hope Virgo. She is also another amazing campaigner. She's been doing work around eating disorders, and she's been a great supporter of some of the work that I've done. And again, if you can look up her work, it'd be advantageous to do that. It was interesting because she has campaigned about changing NICE guidance around how people should receive care. One of the problems that she faced was that she wasn't thin enough to get eating disorder care. So it's that kind of real, disgraceful situation where people have to make themselves more ill to be able to receive the care, which is then less positive and successful because they're coming into it in a worse situation. She actually got the Labour Party to agree to some of the demands that she had in their manifesto. Unfortunately, they won't be delivered now because we didn't get a Labour government at the time. But again, the importance of individuals campaigning on things that they're passionate about, because, even individuals who have had huge issues and difficulties can achieve great success. And we've also seen other situations. Marcus Rashford as an example, the amazing work that he did around school meals, and the situation that it takes an individual having to kind of say to the government, it's a bit rubbish, the fact that we're not feeding children over school holidays. It's not a huge amount of money. Can't we have the compassion that says that these people are worth that care and support? Now, I wanted to just give a bit of a health trigger warning now. I'm going to show a picture that might be a little bit distressing to people. It's just a picture of a baby in special care. So I just want to kind of say, if people have got experiences of that, then they might want to just think about sort of turning off now, or if they, just want to take a moment, that's absolutely fine. Now, the reason why I'm sharing this picture is this is a little guy who I know quite well called Rory. And it kind of links into this bit about why is politics, and why should we as healthcare professionals be really interested in politics. So I remember it was back when I was actually a kind of a commissioner in a local authority, just kind of left health visiting shortly before. And I had arranged to meet some of the health visitors that I used to work with at the local Nando's. And I was driving on the way there, and I got a call from my mum, and she was phoning me to say that my sister had gone into labour. Now, at that point, it was obviously quite a distressing call because my sister was only 28 weeks pregnant. And so going into labour was not the right thing for her to do at that point in time. And I can still, when I talk about it, when I do these lectures, I can still feel the kind of emotion that runs through me as I talk about it, and distress on the day, and kind of thinking back about, thinking will my sister survive? Then the kind of, well, hopefully she will. So will the baby survive? Well, hopefully he will. Will he be damaged? Will there be any long-term impact of him being born at 28 weeks? And you kind of have all these thoughts that are swirling around in your head. But the thoughts that never came into my head were, can we afford this? The thought that never came into my head was, would he get appropriate care? Would he get the best care? Would my sister be well looked after? They were just kind of taken as, automatics, that she would get the best care that she could get in the NHS, and it would be as good as anyone could deliver. And if anything went wrong, it wouldn't be for the want of their care and expertise and trying and energies and resources. And I didn't have to think about those things. I just thought about the emergency issues. And I think that really links into the bit about why I feel really passionate about being engaged politically and being the person that I am, because I genuinely believe that for the work that we do, it's so important that we defend and we fight for and we argue for better health services. And there's a real vested interest of why we should do that, because not only is the bit for me about, I want my fellow person in the street to have a good, decent, honest, supported life that is productive and enjoyable, but also I want the people I care for to have that. I also want myself to have it. And I think back a few weeks ago that I contracted COVID whilst working as a nurse, being taken into hospital. And that bit about, being able to go into accident and emergency and know that there would be people there to look after me, to know that they were putting themselves at risk to make sure that I got through the other end. It's just hugely kind of important that we retain all that good stuff that we do in the NHS. And it kind of links into some of these things that I wanted to share as we wrap up. That Boswell et al. Concluded in 2005 that nurses can make a difference if we combine our privilege with our responsibility. And we are hugely privileged, not just in terms of sharing the lives of the people that we care for, but also in terms of having a role that actually makes a huge difference. I can speak to some people and they would kind of say, I hate my job and I don't feel like I make a difference. I get up, I go to work, I come home and I go to bed and I've not made a difference. And obviously, I'd argue that's not the case. But we really, as nurses, as health visitors, as school nurses, we should be clear that we do make a huge difference. I think what's sad in terms of school nursing and health visiting at the moment is people might feel that actually they're not valued, they're not recognised, they've not got the value that they should have. I see the value that all you guys will have and have now as students. I know the important part that you're playing to improve society. And even when, but probably especially when times are tough, the fact that you turn up every day and you try and do your best will make a huge difference to people's lives. And I'd be hugely surprised if they tell you that you've made a difference every day. Probably not every week. Maybe once a month you'll get one glimmer of lovely comment that you think, no, that's really been worth it. But trust me that, the impacts that you'll be making day in, day out are hugely beneficial and make a huge difference to the people's lives out there that you care for. And I'm lucky to work with lots of charities, for example, who tell me the difference that you make in terms of the work that you do. They talk about the feedback that they get from people that they support, and it's hugely beneficial. A few years ago, I did the Health Visitor Week, and we shared stories from parents who said about the impacts that health visitors had had, from the mundane of, just when I feel a bit stressed, they make me feel a bit better, to that I wouldn't be alive today if it wasn't for my health visitor. And again, in terms of school nursing, having to work with people that often can be really difficult to work with. I know I've got a few kids of my own, and the kind of frustration and anxiety that comes with having that responsibility, but making that difference is huge. I wanted to share a quote that I often have in my head, and this is: the only thing necessary for the triumph of evil is for good people, good women, good men to do nothing. And again, that kind of approach of, there could be so much that goes wrong with the world, and sometimes bad things do happen, but we have to hope that we've got good people out there that are trying their best, that are willing to stand up and argue against those bad things, that are not willing to be silent, that are willing to protest and are willing to talk and advocate for people that desperately need that advocation. So, hopefully that will be something that you can take on into your professional careers, whether that's involvement with Unite, CPHVA, whether it's involvement with another organisation, whether it's involvement with stuff that happens if you volunteer or through charities or whatever. Just have a role, take a part in society and make sure that you try and make the world a better place, because that impact will be felt and will be great. The International Council of Nurses argued as part of their 2017 International Nurses Day theme, A Voice to Lead, nurses' ability to effect change is just as important as the technical ability to deliver safe and effective care, and they are influential at all levels. Leadership is a process, not a position. Contemporary views on leadership have moved towards collaborative processes that take place in groups and communities. Leadership is tied to social responsibility and good citizenship, which connects to nurses' professional and ethical responsibilities to champion the human right to health. Again, you've got such important roles. And again, that bit I said earlier about know who your local MP is, know who your local councillors are, get in touch with them, speak to them, influence them. And again, it's important to do that at times when things are going well, because if they recognise you as a face, as a voice that talks to them about things that are positive, when you come to talk to them about things that you're concerned about or anxious about or negative, they're much more likely to listen because they recognise you and they value the voice that you have. Even if that person is diametrically opposed to your political point of view, conversations are still important. And I speak regularly to people who have different political views to myself. Sometimes I might get quite frustrated by those conversations, but I still make sure I have those conversations because it's critical to do that, especially because you never know which is the conversation that you have that might make all the difference. And ultimately, if we all try and do this, it might not be that as a collective we can succeed, although we're much more likely, but as individuals we can also succeed as well. You never know if you're the person that is going to have that conversation that makes all the difference to that person who then has a different behaviour that then has an impact that then changes the world that we live in. So even though this can be quite ethereal and quite grand, it's important that we kind of think about those issues and we see the impact and the importance that we have as individuals. Now, I hope that's been interesting. I reckon I've taken about an hour and a half of your time, which is kind of what I was expecting. So